dito po. Banyo po yung kabila, sir. Kung gusto kayo
Oy, chef.
seat.
Teka lang, tinatanong nila, chef, saan ka daw, paano ka daw makakontak? Kasi para matikman yung iba pang luto mo.
Halika, chef.
Ay, hello po, Doc.
Pasok na ako.
Chef, may nag-text. Saan daw ba kayo? Ay, oo nga pala. Chef, for the benefit of society and para na rin sa aming lahat at sa tiyan ko, paano ba namin kayo makukontak?
You can contact me through my cell phone number, 0917-550-4546 or through my landline, 415917.
Ayan, sige, text meet kita mamaya. Pakain.
Facebook na
Restaurant
tayo.
po kayo, wala.
We have catering services
Catering
lang.
services. Okay. So, kahit anong cuisine.
Yes.
Okay.
Maraming salamat po, Chef.
Very good.
My pleasure.
Sir, maupo po tayo.
Halika, dito naman
Welcome.
ang
Good morning,
Doon po kayo.
Good morning.
Yan si Doc
Have a seat.
Vic
Good morning,
Santos.
Dr. Pebbles. Hello.
Kasi dito, katabi na kayo ni Kong. Presidente ng Fatima Medical Center. Lahat na nasa kanya na.
Ako rin na kayo makapagpaayos ng mata.
Sure,
Basic
anytime.
surgeon. Oo, kami ni Attorney Reg, hindi namin makakalimutan.
Balita ko si Atty.
Pinaka-favorite na, favorite person ko yan si Doc.
Ay, thank you very much.
I saw the light.
Yeah, sa LASIK.
Balita ko si Reg, halos
Attorney
umiyak
Reg.
daw eh. Nung,
He's okay. Okay na siya ngayon.
hindi sa takot.
Sa umpisa, once we got going, okay na naman siya.
Oo. Pero ngayon kasi kaya nandito si Doc Vic kasi pag-uusapan natin, isa sa mga natulungan din niya tsaka ng UNTV, isa sa mga cameraman natin, si Wisdom Ison na, Doc, ilan yung grade niya? 1,000?
Si Wisdom, ayan, nasa, ano siya, no?
Oo, nasa.
He has a very high grade. Ang grade niya ay 1,100. Wow.
Sana
So,
ganun
with-
talaga sa school yan eh. No?
With an astigmatism of 400.
So pag wala na yung salamin niya, totally blind
He
siya.
can probably count fingers or hand motion. So,
Is it was that a congenital condition?
I have no idea what it was. It probably is kasi
Because he seems to be young pa, no?
he's young, yeah, he's young. But you know, people who have high myopia tend to have it at an early age also. So may congenital factor po siya, no? Yung pagiging high myopia.
Can you imagine yung tulong na nagawa sa kanya nung surgery na to, yung procedure na to? Kasi di ba cameraman siya, nag-photographer siya, talagang it requires yung mga ginagawa niya ng eyesight. Talagang naging malaking tulong tong
What
procedure,
procedure
na to.
was done on him?
Well, actually, kaya ko gustong i-present ito dahil we had to do two procedures on two eyes. No? Ang unang ginawa namin, yung tinatawag na... Okay, first of all, I'd like to tell you bakit hindi namin
Yun nga.
pwede gawin. No? There were two options. No? As I've said, he had high myopia, 1,100, plus an astigmatism of 400. Yun po ay hindi na kaya ng kahit anong laser. Kasi po, ang ginagawa ng laser, pag tinamaan yung cornea, nababawasan yung layer ng tissue, panipis siya ng panipis. It will be too dangerous if we did it like that. No?
Doc, sorry, hanggang anong grade lang makakaya yung laser?
Well, presently, it's up to 1,000.
Hanggang 1,000?
Plus, but not counting the astigmatism. If you count the astigmatism, you add that also. So, basically have 15 diopters or 1,500 na grade na dapat natin ma-correct at hindi ho kaya ng laser yun. No?
Doc, you keep mentioning about myopia. Ano po ba yung myopia in layman's term?
Well, myopia, yun yung malinaw sa malapit, malabo sa malayo.
So which is may ganun si Wisdom?
Ganun nga si Wisdom. Kasi si Wisdom, kung magbasa na ganito kalapit. Pero actually, natutuwa rin nga ako sa UNTV dahil kasi hindi nila ginawang sagabal yun sa pagkuha sa kanya. Because napakalabot. Technically, someone who has visual ang kanyang trabaho, cameraman, photographer, kailangan malinaw ang paningin.
Yes.
Pero lumilinaw naman pag may salamin. Kaya lang, yung salamin
yung
parang kapal.
salamin
Puwet ng baso, sobrang kapal.
Ang bigat.
So, we had several options. Ayun, nakikita niyo po, ito yung refractive lens exchange na ginawa po namin. No? Ano ang ibig sabihin ng refractive lens exchange? yung lens na
Parang ang
natural, we took it out and replaced with a lens that will correct the grade.
Di ba ginawa mo rin yan sa akin, Doc? Yung
Hindi yan.
Hindi ba yan?
Ito,
Parang yung Philip
this is what happens in cataract surgery.
Ah.
So, hindi ganyan.
Hindi ba ganyan?
This is more invasive
Oh
than...
my gosh.
This is more invasive than the LASIK. Ngayon, well,
Iba pala ang feeling
we could have
pag-
done it with one surgery.
Okay.
We could have placed a very special lens called a multifocal toric lens. No? Ang problema lang po nun, napakamahal po niya, no? At beyond the resources of wisdom. So, we did this surgery pro bono, but, we cannot afford to give him the lens, which is very, very expensive. So, we
Roughly
did
how
that.
much yun, Doc?
It can vary, but the procedures would reach for 2 eyes, would reach into the 6 digits. Medyo out of reach para sa most people, out of reach siya. So what we did was the next best thing. Ang ginawa ko namin ay 2-step procedure. So we took out the lens, placed an ordinary lens that would correct for the distance, no? Pero hindi pa niya nagagalaw po yung astigmatism.
Oh my gosh.
So, yung astigmatism po ay kinorek naman with the second procedure known as photorefractive keratectomy. Yun naman yung laser. So, 1-2 combination po ito, no? So, we did lens replacement or cataract surgery even without a cataract. And then we did a photorefractive keratectomy, yung PRK na
Doc,
tinatawag.
itong cataract surgery na ginawa niyo sa kanya, even wala pa siyang
Cataract.
cataract, pagtandaan niya ba, maganda to, ma-prevention? Hindi din.
Mape-prevent siya kasi once you take out the
na
cataractus lens, wala na siyang wala na siyang lens na magiging
Catarata.
That's nice.
Ang namumuti po yung kapsula na pinagpapatungan ng lente, maari ho siyang mamuti. Pero yan, isang uri-uli ng laser, it's called the YAG capsulotomy laser. Binubutas lang. It's a 1-minute procedure.
Parang to release. Yung,
To remove the opacity. So maaaring mamuti yung kapsula na pinagpapatungan, pero isang laser lang, maliwanag na naman po ang makikita niya.
One time, ano po ba to, Doc, yung mga procedure, isang operation lang na oras? Or
We did
may iba-ibang
actually-
araw?
Iba-ibang araw. Technically, we could have done 2 eyes in one sitting. Kaya lang, in the 1 in 10,000 chance na magka-infection,
Yeah.
dalawang mata yung
yeah.
dalawang mata yung apektado. So, we
And so
like to have it done. You're seeing now in the video, I'm looking through the mirror, is photo refractive keratectomy. Ito naman po yung laser.
Immediately after,
It
can
was
you use-
about
recovery.
the books say about 3 months, but for wisdom, because he had to use his eyes right away, we elected to do it about a month and a half afterwards.
in between. So you cover one eye, and then so he's just using one eye until it recovers?
No,
or-
we meant doing the PRK.
Okay.
The other eye was done a week after. So one eye for the cataract surgery, the other eye, and then 1.5 months after we did this PRK, which you're seeing now. That's an alcohol solution on top of the cornea para ano yung epithelium, and then laser will be done on him. So yung mga natirang grado na hindi maabot ng laser,
So, sa
ngayon
laser.
abot na siya.
After the procedure, Doc, 20/20 vision na po yan.
He's seeing 20/25, but with both eyes open is 20/20. From someone who is seeing
Yeah.
like this, no? Now without glasses, he's seeing 20/20. 20/20 both eyes
nating
open.
natutunan.
20/25. It's quite a feat also dahil as the grade goes higher, the probability of hitting 20/20 is a lot lower.
Yes.
Oo, ayan.
This
Ito
is
na.
one of the
Ito na.
success stories that we have.
Oo, yan, ang dami nating natutunan ngayon kay Doc Vic. Doc Vic, very quick lang po kasi interesado sila dito, yung mga kasama natin dito sa GMK na if ever magpalisik sa inyo, where can they contact you?
They can contact me at number 291-2020. Madali pong alalahanin. Alalahanin nila 2020. And just put the prefix na 291. And can be contacted.
Doc, last question. Kasi malabo yung mata ko. Nasa 350.
Yeah.
Candidate na ba for ano yun?
Yes.
Later? Pwede na?
Yes, but we go through a screening procedure. It's a bit of ano po,
Medyo
psychology
mahaba.
testing.
Ay, may ganon.
Dahil kasi if you're not happy and you have a very high expectation, we try to temper it down. Yeah. And then we want to check the thickness of your cornea. Baka mamaya masyado siya manipis. We did all that. The procedure itself is about 5 minutes.
Okay.
But the screening is about 45 minutes to an hour.
Yan.
Just to be sure.
Sige, Doc, balikan ka namin. Punta muna natin si Lynn Perez para sa ating barangay. Konsulta mo. Ate Lynn, saan ka?